The neonatal unit and transitional care.
Sometimes babies need care in the neonatal unit when they're born. The most common reason is prematurity, where your baby's born early, before 37 weeks. But babies born after this may also need to be admitted to the unit, or may be suitable for transitional care. This would mean that you are still with your baby and caring for them whilst they receive some extra observations or treatments. This will take place either on the postnatal ward or in a parent bay on the neonatal unit. This allows us to give them the extra care they need whilst you remain together. If your baby requires more care than this, they'll be admitted to the neonatal unit. You will have open access to your baby at all times, but just won't be able to have your bed beside them. Preterm birth can be because labour starts early, or it may be planned because it's the safest option for you and your baby. For example, if there are concerns about how your baby is growing. Sometimes we will consider moving you and your baby to a unit that can provide more intensive neonatal care.
Other reasons your baby may need to be admitted. Babies may need help with controlling their temperature, breathing, or maintaining normal blood sugar levels, especially if you had diabetes during your pregnancy. It is also more likely that your baby will need support if there were any problems with the baby's growth, or any underlying health conditions were diagnosed at your scan or straight after birth. Your baby may need treatment for infection or early onset jaundice. What to expect to see on the neonatal unit? As you arrive on the neonatal unit, you will be asked to wash your hands before entering the ward. If your baby is having intensive or high dependency care, you will see incubators. Seeing your baby in one of these can be daunting, especially when there are feeding tubes and monitors in use, but they will keep your baby warm and monitor them closely to keep them safe. You will still be able to interact with your baby, and they will feel reassured by the sound of your voice and touch. If your baby is receiving special care, they may need help with their temperature and oxygen levels. They will be monitored in a normal cot with a heated mattress and small monitor wrapped around their foot. This requires less input from staff, but don't worry, you will still be supported to care for your baby.
Parents of babies receiving care on the neonatal unit aren't treated as visitors, but as joint caregivers. We understand this can be a scary time, and the team will keep you informed and answer any questions. However you choose to feed your baby, the team will be on hand to support you. Breast milk is highly valued as part of every baby's journey on the neonatal unit. If you're separated from your baby, your breastfeeding journey will be helped by early expressing as soon as possible after birth. Even better if this can be in the first hour. Babies born early may need extra time to learn how to feed, and this is an important goal before you go home together. If your baby is unwell, it can be very easy to forget that you need ongoing care for yourself. Whilst you're still admitted, the maternity team will continue your care. If you're discharged home and spend a lot of time with your baby at the hospital, it can be easy to miss appointments with the midwife. You're a priority too, and your postnatal care can be provided wherever you are. Having a baby admitted to the hospital can be a difficult time for the whole family. Your partner and other children may also need extra support whilst you spend time with your baby. The midwifery and health visiting team are there to support you as a family in any way they can.
To find out more, visit sneewellbeing.org.uk/maternity.